Welcome to Fast and Furious MCQ edition. Let's learn about the vaccine topic. In the vaccine, we learn each of the vaccines, and the vaccines are divided as live vaccine or killed or inactive vaccine, and subunit or recombinant vaccine, and polysaccharide vaccine, glycosaccharide vaccine, and toxoid vaccines. Let's see each of this. First, the killed vaccine. The killed vaccines or the inactive vaccines, these are less effective than live vaccines. Because of this less effectiveness, they require booster doses. For example, if the person gets a dog bite and infected with the rabies, he requires the dosage of 0, 4, 7, 21 and 28. This is the dosage of rabies vaccine. So in case of killed or inactive vaccine, the person requires booster doses. The killed vaccines can be remembered with the mnemonic: a rabies infected person got killed. This is the mnemonic, and here A stands for hepatitis A, rabies stands for rabies vaccine, and INF in infected stands for influenza vaccine, and P stands for polio, that is mainly injectable form of polio, which is also called as SALC, which is a killed or the inactive vaccine, whereas the oral polio, that is Sabin, is an oral vaccine, and C stands for cholera and typhoid, or this killed vaccines. Next, moving on to the polysaccharide vaccine. The polysaccharide vaccines are derived mainly for the capsulated organisms, and this is an antigen or a bacteria with a capsule. This capsule is extracted from the bacteria and it is injected into the person. That person produces antibodies against this capsule. These are called the polysaccharide vaccines, and this can be remembered by the word polysaccharide. So they have poly C's. Poly C means many C's. The vaccines are pneumococcus vaccine, meningococcus vaccine, Haemophilus influenza, and typhoid. So these organisms are capsulated. So the vaccine derived from this are polysaccharide vaccine. It's mainly for capsulated organisms, and it can be combined with the protein to increase its effectiveness. As the vaccine is derived from the capsule, they are serotype specific. It differs for each species, so these are serotype specific. Mainly, this polysaccharide vaccine is given to the hereditary or familial or acquired cause of asplenism in the patient. Asplenism means the persons without spleen. The persons without spleen are more prone to get this capsulated organism infection. So polysaccharide vaccine is must for these patients. Next, moving on to the glycosaccharides. The glycosaccharides are also to the capsulated organisms, which includes pneumococcus, meningococcus, and Haemophilus influenza. Next, moving on to the recombinant vaccine or subunit vaccine. Here, recombinant vaccine can be remembered from the middle word COM-B. Here, COM-B, B stands for hepatitis B, and COM-B stands for cholera type B vaccine, and human papilloma virus vaccine, and vaccine for Lyme's disease. These are the recombinant or subunit vaccine, which means a part of the antigen is removed. The part of the antigen which has the virulent property, for example, HBsAg is a subunit present in the hepatitis B virus. That subunit is removed and that is injected into the person. So the person produces antibodies against that subunit. So this is called the recombinant or subunit vaccine. Next, moving on to the live vaccine. The live vaccines or alive vaccines, these can be remembered with mnemonic: the Japanese mom brought alive from Yellow Palace. Here, Japanese stands for Japanese encephalitis. This is the mnemonic. Here, Japanese stands for Japanese encephalitis, and mom or stands for measles, and mom can be pronounced as mum, so mumps. And B stands for BCG vaccine, or O stands for Rota vaccine, and alive is the live vaccine. Here, I stands for influenza, and B stands for B and E stands for varicella. From R stands for rubella, and O stands for oral polio vaccine, which is also called the Sabin. The oral polio vaccine, Sabin, is the live vaccine, whereas the injectable polio vaccine is the killed or inactive vaccine. In Tamil, we say food as sapadu, so which is taken orally. So oral polio vaccine is sapadu, which is Sabin, which is remembered as Sabin vaccine. And yellow palace, here yellow stands for yellow fever and palace stands for plague. These are the live vaccines. Once again, the live vaccines are remembered with the mnemonic Japanese mom brought alive from Yellow Palace. Here Japanese stands for Japanese encephalitis, M stands for measles, and MOM can be pronounced as MUM, so mumps. B stands for BCG, and RO stands for rotavirus vaccine, and or RU stands for rubella vaccine. Here R stands for rubella, and O stands for oral polio vaccine or Sabin. Yellow stands for yellow fever, and Palace stands for plague. These are the live vaccines. And some of the properties of live vaccines are the live vaccines are most efficacious vaccine, and they can be given simultaneously at the same time at the same visit, but not in the same anatomical site. At the different anatomical site, the two live vaccines can be given at the same visit. But if we want to give on an intermittent basis, there should be a time lag of 4 weeks between one live vaccine and the other live vaccine. From one live vaccine to the other dose of another live vaccine, there should be an interval of 4 weeks, because if the antibody can interact each other, and the live vaccine and immunoglobulin or antibody should not be given at the same time, because the two mixes with each other. So there should be an interval between 3 weeks before or 2 weeks after that the live vaccine can be given. If the patient is taken an antibody, just 3 weeks before or 2 weeks after a live vaccine can be given. All other vaccines like killed vaccine or inactive vaccine, toxoid vaccine, or polysaccharide vaccine or subunit vaccine, the vaccine along with the antibody or immunoglobulin can be given. Only the exception is that with the live vaccine, it should not be given at the same visit. Either it is given 3 weeks before or 2 weeks after the antibody dosage. And in case of contraindications of live vaccine, because it is a live vaccine, it is contraindicated in immunocompromised patients. And some of the live vaccine are also contraindicated during pregnancy. For example, MMR vaccine, BCG vaccine, yellow fever, and varicella are contraindicated during pregnancy. And some vaccines are also contraindicated during radiation therapy. The main contraindication of BCG vaccine is it is contraindicated in symptomatic HIV patients. In symptomatic HIV patients, BCG vaccine is contraindicated. Yellow fever and influenza, egg allergy is contraindicated. This also can be remembered as the yellow yolk is seen inside the egg. Inside the egg we have yellow yolk. So the influenza vaccine and yellow fever are contraindicated in case of egg allergy. These are the contraindications. And in case the patient is HIV positive and symptomatic, the vaccines should be given, and the vaccines does not be given are the BCG should not be given, and oral polio vaccines should not be given. If the BCG vaccine may be given, it leads to disseminated BCG infection or disseminated TB. So in a HIV patient who is also immunocompromised with symptomatic, live vaccines like BCG and OPV are contraindicated. If the CD4 count is less than 15, that is severely immunocompromised, even MMR vaccine is contraindicated. If the person is HIV positive and symptomatic, the other vaccines like MMR and IPV can be given only if the CD4 count is less than 50%, that is severely immunocompromised. Even MMR is contraindicated. Let's see few peculiar adverse effects of the vaccines. In case of BCG vaccine, we have local ulcers at the site of injection, and sometimes the abscess may collect, which is a cold abscess, and regional lymphadenitis may develop. In case of Japanese encephalitis, the word encephalitis, so the adverse effect is encephalitis or encephalopathy. In case of DPT, the child will have the persistent inconsolable cry, and they are also prone to develop encephalitis or seizures or hypotonic hyperresponsive syndrome and anaphylaxis. In case of hepatitis B, we have anaphylaxis reaction as a common or peculiar adverse effect. In case of MMR vaccine, the person may get febrile seizures or thrombocytopenia. This can be remembered as MMR have the reduced level of platelets. So thrombocytopenia and febrile seizures are seen in the MMR vaccine. And polio, we have the paralytic poliomyelitis. And in case of influenza vaccine, oculo-respiratory syndrome may occur and Guillain-Barré syndrome may occur. In case of yellow fever vaccine, viscerotrophic syndromes may occur. Next, moving on to the toxoid vaccine. The toxoid vaccines are DPT. Here D stands for diphtheria toxoid and P stands for pertussis, and mostly that is acellular pertussis, that is used in combination with DAPT. We also have a whole cell killed pertussis vaccine, which is more prone to have the encephalitis, so it is not used now. Acellular pertussis is commonly combined with the DPT vaccine, and T stands for tetanus. Other toxoid vaccines, anthrax and influenza, are the toxoid vaccines.